Bienvenidos a Carlos Pharmacy. La dirección es 18 East de la 183, Bronx, New York, 10453. Y el número de teléfono es 347-271-6262.
5, 10, 15, 20, 25, 30. Hello. How you doing? Welcome to Carlos's Pharmacy. I want to thank everybody who's been a participant over the last year or so of our naloxone program, which has been a success. We have been added to the Medicare program for naloxone. So if you are over 65 and you want to carry naloxone, come to the pharmacy, and your copay will probably be picked up by New York State. And we've saved many lives here in the Fordham section of the Bronx. It's been a good program, and we've done very well, and we should all be proud. Now I'd like to discuss, if you don't mind, another subject which is a bane to this community, which is unwanted pregnancies. Unwanted pregnancies, unfortunately, is far more common in this community than we'd like to have, and it's been discussed, and we've tried to do things about it for many years. Now, New York State has finally allowed pharmacists to prescribe birth control tablets. So let me go over some of your options that you have. So, because no woman should really have to have an unwanted child that she's not prepared to support and to love. And this is not a good situation for the child. It's not a good situation for the parent. It's not a good situation for the community. And it doesn't have to happen. So the first thing, of course, if you're really, having a bad weekend and you're on a bender, all right, and something happened that you didn't expect, or other circumstances that are less than that, then there's the morning after pill, which is available on Medicaid from the pharmacy or for cash over the counter. Emergency contraception like My Way. My Way is levostrol, and it is got to be used within 72 hours of having unprotected sex. All right, and it has very few side effects, if anything. It resets your cycle. That's one of the things that it does. There's also another form of this, which I don't have handy to me, but called Ella, E-L-L-A. It can be used within 5 days of having unprotected sex. And Ella is called, the generic name for is 30 milligrams ulespestrol. Okay, don't ask me why they can't create names for drugs that people can pronounce, but that's the way it is. It's called ELLA, and it's available also. At the moment we don't have it in stock, but it's something we do normally carry for patients that need it. But usually the Plan B works fine, which is what the first kind is. And within 72 hours you can use that. Ella is in 5 days. Okay. Now, in addition to that, obviously, you also have available contraception devices such as condoms. The advantage of a condom is it does a pretty good job of protecting you from potentially catching a disease like HIV. Now I'd like to talk to you about one thing that's happened since 2023. Is that the FDA has approved an over-the-counter birth control tablet called Opill. O-P-I-L-L. It's expensive and it's only available as brand. It's a progesterone-only contraception, and the reason why that's significant is because contraception that's progesterone-only has an advantage of that it has fewer contradictions. So if you're taking this regularly, you would take it every day for 28 days, then what would happen is it helps change the way that your uterine wall is, so that it doesn't accept a pregnancy. So it prevents pregnancy like this. But the advantages of it, even though it's not exactly like the way your body normally works, but there's huge advantages in that it has very few contraindications. Contraindications are conditions where the patient shouldn't be taking the drug because the risks start to outweigh the possible benefits. So in this case, if you're using the over-the-counter pill, which is called Opill, all right, which is progesterone only, the only contraindications are breast cancer. Breast cancer is very sensitive to progesterone. It'll make it grow very fast, so you wouldn't want to do that. Or if you're actually pregnant, which obviously, if you're pregnant, you shouldn't be on birth control in the first place. Okay, so that's the reason why the FDA allowed it to come over the counter. There's also a lower dose progesterone called a mini pill that's available, but that's only available with a prescription. It's also available from the pharmacist if he prescribes it for you also. Now, the most common form of birth control is the birth control tablet, and it tries to mimic your body's natural cycle, so that it involves two hormones usually, an estrogen and a progesterone. And without getting into the whole complexities of how these hormones work, when these drugs, they provide a steady state of these hormones in your body, and then at the end of the 3 weeks you stop taking them, or you might have just another week of blank drug in there with just a vitamin or iron, and then at that point what happens is that your body, when it's cut off of the hormone, resets its cycle. So this takes full control of your cycle, and it prevents you from essentially getting pregnancy. And they have side effects, but the side effects are minimal. But because they have estrogen in them, they come with a whole slew of contraindications. If you're over 38 years old and smoking, generally they don't recommend it. There's obviously still the problem of cancer. Breast cancer, you shouldn't have it. There is a contraindication if you have migraines, you shouldn't use it. Also, if you have hypertension above 160 or above 100 on the systolic and the diastolic, and a variety of other risks. If you have a risk of any type of venothrombosis, which is you have problems with your legs, with circulation, and that can pose a risk, then they suggest that you don't use these type of combination contraceptives, the ones that have estrogen in it. Now, why estrogen is more sensitive than progesterone, that's a whole conversation to have, but this is our current understanding of it, and we have learned quite a bit of experience since the mid-1950s when these things first started. Now, let's talk about the real world, though. The real world is that, okay, they give you a young girl, or even an older woman, right, the drugs to take, right? And they give it to you, and you open it up, and it comes in a little packet, and the packet has 1 week, 2 weeks, 3 weeks, 4 weeks. The problem is that people forget to take their medicine, or they take it in the wrong time of the day, or they forgot until the middle of the afternoon. It's hard to take a pill every day or a tablet every day. You forget. Even when I take an antibiotic and you're supposed to take it for 14 days, I find myself pouring it on the counter and then counting it because I forgot if I took the tablet or not in the morning. I mean, it's not easy. And in the real world, these are supposed to be like 91 to 94% effective, which means that 100 women per year, remember this is per year, 6 of them will get pregnant if they do everything right. But in the real world, this number drops down to like 85%, because in the real world, people forget, and they may store the medication improperly, and it may not be effective, or they may be overweight. And there's a variety of different problems that happen in the real world so that it drops down to 85%. So what does that mean? 85% means that 15 women per year will get pregnant, even with the birth control tablet. So this is a problem. And it's tried to be addressed in several ways. One way to address it, and my favorite way, is with these handy-dandy birth control patches. They're like the nicotine patches or the other patches you've seen. You simply take this off, you put it on your arm, and at the end of the month, you take it off your arm. And it's got a little thing here that Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. So it reminds you what the day you have to remove it at. And it's resistant to normal things like taking showers and so on and so forth. And it works pretty well. And in the real world, this gets up to a 94% effectiveness at preventing pregnancy, which is pretty good. That's 6 women per year will still get pregnant while using the patch, whereas opposed to 15 on tablets. Okay, so now we discussed the patch. Just to review the patch just for a second. Usually, these come 3 in a box, and you use 1 a week, which is why the box gives you a day that you can change it. 1, 2, 3. Okay? And then this fourth one is not a patch, it's a little directions about this. Okay, so that's the patch. You got to change them once a week. That still takes a lot of the pressure off, and they work very well. The rings, on the other hand, these are vaginal rings. You would put them in your vagina. I don't have a vagina, so I can't show you, but if you have a vagina, you could certainly try it. All right? And each one of these rings goes inserted into the vagina between your uterus and the vagina wall. There is diagrams to show you how to do it. And these are usually refrigerated in the pharmacy, but you don't have to refrigerate them. You can if you want to. But they're good for 3 weeks, which is a whole cycle, 1 per patch. So in this box, you get 1, 2, 3. So that's good for 3 months. So you would take this, insert it into your vagina, and gently put it into place, and then it would deliver hormone to your uterus, just like the tablets, except it's not systemic. The chemicals and the hormones are right where they need to be. It has much fewer side effects in general, and they are great at preventing pregnancy. The downside is that some girls have problems. It's really in their minds of trying to insert these into the place where they go. But before there were patches, we used to have diaphragms, and the girls used to use those and fill them. They were basically a rubber cup that you would fill with spermicide and put it into place, and they were also a very effective form of birth control. This is different because it's actually got the birth control chemicals, the hormones in your body. Other than that, they work pharmacologically very similar to the birth control tablets. They have estrogen and they have progesterone, which means they have all of the contraindications that an estrogen tablet would have. But they're very simple to use, and they have almost like 96% real world results. It means once the girls learn how to use them, only 4 women per 100 per year get pregnant with it, which is a pretty good ratio. One thing that you should understand about all of this, of course, is that in the real world, there's no such thing as an absolute form of birth control, you have to try to figure out the risks versus the benefits. And you have to do what's comfortable for you. But by all means, come. It's a quiet pharmacy, as you can see. We have room here. You can have a private conversation. We'll do the entire physical, not a physical, but a health review with you. We'll take your blood pressure, and we'll get you the birth control that you're comfortable with, that's going to be most effective for you. Okay, thank you.
Bienvenido a la farmacia Carlos, 18 Este de la calle 183. Estamos aquí para servirle.